Hi, I'm Grace, and welcome back to If I Got Laid Off Tomorrow. The job today that I want to talk about is a bit more generalized to encompass a few different areas of practice, but today I want to talk about therapy aides or therapy techs. Therapy aides provide support to licensed therapists, whether it's occupational therapy, speech therapy, physical therapy, all sorts of different areas of healthcare. As a supportive role, they help get the practice space set up, like they'll set up the treatment areas, get the equipment ready, help the patients move around, keep the space clean and organized, and they may handle some of the scheduling and the paperwork. So you're not diagnosing or creating any of the patient plans. Your job is to support the therapist and the patients so that all the sessions run smoothly. Many therapy aides will work in outpatient rehab clinics, hospitals, skilled nursing facilities, or even school-based therapy programs. It really depends on which area of work you're looking into. And the environment can range anywhere from a fast-paced sports rehab clinic to quieter long-term facilities. There's all sorts of therapy aide tech positions out there in the different fields of healthcare. And each position will look really different depending on the type of clinic or practice you're in, so that's why I wanted to keep this one a bit more general. But it's really nice because there's a lot of different environments you could look for work and different opportunities and possibilities. Similar to my post about the QC techs. Most of these roles will only require a high school diploma and on-the-job training, and some employers will have requirements for different certifications that they might want you to get. Like one of the jobs in Portland I found requires you to be a certified personal trainer, while this other job I found has a completely different certification, but they'll give you 3 months after starting the position to obtain it. So the different requirements will depend on the roles that you're looking into. If you enjoy the work, you can keep moving up and you could even become a physical therapist assistant, occupational therapy assistant, or other licensed therapy roles. I see these jobs popping up all the time and they're really high in demand. Since these are entry-level roles, pay will typically start out around $14 to $22 an hour, completely dependent on the location and the type of role. It's not high starting pay, but it is stable, and we've been seeing more demand, especially on the rehab side as our population continues to age. You'll want to expect to be on your feet most of the day, help lift and move patients, and occasionally deal with insurance paperwork or scheduling. It's high in demand, there's low barriers to get to it, and there's opportunities to advance in the career if you want to do so later on. Which is why if I got laid off tomorrow, I'd consider becoming a therapy aide. If you have any experience in any sorts of these roles, feel free to share about it in the comments, as I have not had this role before. And make sure to follow for more low barrier, high potential careers. See you tomorrow.